1 Introduction. Social work is now a global profession. Most countries in the world have social work education as part of their university systems and offer degree programs in the discipline. There are a number of jobs in governmental and non-governmental sector for which trained social workers are preferred. Professional bodies of social workers have been formed in many countries, which play an important role in facilitating professional interaction and promoting common interests. National governments and the civil societies are convinced that social workers have a specialist role in many areas in the social sector. International bodies of social workers have raised the global profile of profession by contributing their expertise to international organizations like UN, WHO, etc. While social workers can be pleased at the growing recognition, the process is still ongoing and faces considerable challenges. Social workers cannot still say that their profession is recognized and accepted on par with other professions like medicine, law, management, and nursing. Moreover, the growth of the profession is geographically uneven. In some countries the social work is fully recognized as a profession while in others it is still gaining recognition. In many universities there are separate social work departments staffed by trained social work teachers while in other universities sociology, women's studies and other social science departments teach the subject. Yet in some countries social workers are employed mainly in the government sector while as others they are part of civil society. Joseph Varghese, Dr. Joseph Varghese, Visva Bharati, Sriniketan. Social work profession and education. 6. Organizations. Many differences in the content, teaching and practice of social work are due to historic reasons. The profession is influenced by the ideological orientation of the state and the value system of the particular society in which it exists. In order to understand the dynamics, this unit gives an historical overview of the position and the status of social work in selected nations and discusses some of important reasons for the same. 1.2 Social work in Europe and Oceania. In the pre-industrial Europe, social welfare was the responsibility of the church, the family and the village community. However, the Industrial Revolution and urbanization changed the nature and extent of social problems. Traditional institutions could not cope with these problems and governments had to take up the responsibility of providing social assistance. Since Industrial Revolution took place in Western Europe, it is here that modern-day social welfare system emerged. The growth of social work profession is closely related to the development of the social welfare system. The development of social welfare system was the result of numerous changes taking place in European society. Some of the important changes are given below. Sociopolitical changes included the French Revolution and Russian Revolution, American independence, the rise of social movements and labor movements, democracy and universal adult franchise, decline in authority of the church and the decline of village and tradesmen's communities. Economic changes included the emergence of industrial capitalism, formation of workers' unions, increasing number of children and women in the workforce, periodic economic crises leading to widespread unemployment and poverty. In response to these social conditions, government increased the social assistance programs provided to its citizens. However, it was not until after the World War II that social welfare system became indispensable part of governments. Most governments in Europe developed broad-based social welfare systems as part of their bureaucracies. It was deemed to play an important function in the society by contributing to social equality and peace. It was seen as part of the entitlements of the citizen. However, political changes beginning in 1980s have once again brought about changes in this system. The rise of neoliberalism, increasing fiscal pressure on governments due to globalization, demographic changes, etc. Due to these changes, the role of social work and social workers have also changed. United Kingdom. The United Kingdom, UK, was predominant power in the world for almost 2 centuries before the Second World War. USA, Canada, Australia, New Zealand and South Africa were directly influenced by social changes in UK. Many countries like India, including Pakistan and Bangladesh, Sri Lanka, Malaysia and a number of African countries were part of its colonial empire. In these countries too, the socio-political influence of United Kingdom is extensive and continues even after decades of these countries getting their independence. Therefore, the study of social welfare system and social work in UK is important. Important landmarks in social welfare in UK. King John of England signs the Magna Carta in 1215, which establishes some human rights only for the nobility. 7. Elizabethan Poor Law Act in 1601 authorized the raising of taxes to pay for services to those who were poor, needy, and had no family support, assigning them to assistance as follows: the impotent poor, the aged, chronic sick, blind, and mentally ill who needed residential care, were to be accommodated in voluntary almshouses. The able-bodied poor, who ran away, or persistent idlers, who refused to work, were to be punished in a House of Correction. Fraser, 1984, Incree, 2002, 277. This legislation also influenced American colonies of England. Factory Act 1833 and Factory Amendment Act 1847 regulated the working conditions of children and women in factories. The Poor Law Amendment Act of 1843 divided the poor in England and Wales into two groups. The deserving poor, e.g. elderly, sick or disabled people, orphans and widows, who were to receive financial and practical support, often home-based, from charitable or voluntary organizations. The undeserving poor, e.g. able-bodied unemployed men, single mothers, prostitutes, who were forced to turn to the state, and thus to the workhouse, since there was to be no poor relief outside the institution. Mooney, 1998, Incree, 2002, 278-279. The Great Depression of 1929 affects the society, especially the poor and working class. Policy makers recognize that government intervention in economy is important to address problems caused by capitalism and assist people adversely affected by it. The Beveridge Report, which suggested an elaborate system of welfare to address the problems of want, disease, ignorance, squalor and idleness. The report provided the rationale and broad guideline for the establishment of the modern welfare system in UK. It advocated a comprehensive and universal social insurance scheme. Thatcher's Conservative government brings about major changes in the welfare system, which led to major changes in the social work profession. As can be seen, the original aim of the government was not only to help the genuinely needy but also to exercise control over the population who were seen a nuisance to society. Another aim of the governments was to prevent political unrest and instability. It was in 1950s social assistance programs were viewed as entitlements. Non-governmental organizations, NGOs, too, were involved in the helping the needy in the modern period. The Young Men's Christian Association (YMCA) and Young Women's Christian Association were major organizations which worked with rural immigrants coming to the industrial cities. Two movements, the Settlement House movement and charity organization societies, played an important role in the evolution of modern social work. Aimed at bringing about order into the process by which the charity was practiced. It developed criteria on which among the numerous applicants for aid should be selected and what kind of aid should be provided. It gave opportunities to individuals to get appropriate work when possible. The Settlement House movement started by providing services to children and working mothers, but then later on changed to a non-party political movement which demanded better services for the poor from the government. The approaches of the CUS and settlement houses differed considerably. However, history of social work, global scenario, social work profession and education. 8. Both these movements had people from the middle classes and upper classes getting involved in efforts to address the problems of the poor. These movements also highlighted the need for training people to provide social services. Social work education in UK is now part of the university system. Social workers in Britain were regulated by the General Social Care Council (GSCC) till 2012 and after that by the Health Professions Council. Debates on the changing role of social work in society are popular in academic circles. Social workers are found in the governmental and non-governmental sector and work in the areas of child welfare, correctional settings, health and elderly care. Australia and New Zealand. Australia and New Zealand were British colonies and were influenced by its policies. The Great Depression affected Australia too, like it did Europe and US. The institutes such as the New South Wales Board of Social Study and Training and in Melbourne, the Victorian Institute of Almoners were established for first time for social work education. By 1939, there were total 5 institutions in this regard, 3 general schools and 2 training hospital almoners, in only 3 of the 6 states, Napier and George, 2001. The Second World War created a demand for social workers to deal with some of the consequences of war. Social work at this time was seen as an important occupation and demand exceeded supply. By the end of 1950s, social work education was well established in the university sector. Camilleri, 2005. There was a need of standard setting for qualification of professional membership and accreditation of social work programs. Hence, in 1974, the document Minimum Educational Requirements was made for the establishment of National Council of Social Welfare, Napier and George, 2001. By 1975, there were 11 schools of social work covering all states, with total enrollments of 2,363 students, Napier and George, 2001. In 2004 the number of schools of social work increased to 22. It is estimated that there are 1,000 students are graduated per year, yet social workers make up only a small fraction of the human service workforce in Australia. Camilleri, 2005. By 1939, there were total 5 institutions in this regard, 3 general schools and 2 training hospital almoners, in only 3 of the 6 states, Napier and George, 2001. The Second World War created a demand for social workers to deal with some of the consequences of war. Social work at this time was seen as an important occupation and demand exceeded supply. By the end of 1950s, social work education was well established in the university sector. Camilleri, 2005. There was a need of standard setting for qualification of professional membership and accreditation of social work programs. Hence, in 1974, the document Minimum Educational Requirements was made for the establishment of National Council of Social Welfare, Napier and George, 2001. By 1975, there were 11 schools of social work covering all states, with total enrollments of 2,363 students, Napier and George, 2001. In 2004 the number of schools of social work increased to 22. It is estimated that there are 1,000 students are graduated per year, yet social workers make up only a small fraction of the human service workforce in Australia. Camilleri, 2005. Professional social work education in New Zealand started in the then University of New Zealand, which approved plans to start a school of social work in 1947. However, it had to be renamed as School of Social Science. The graduates of the School of Social Science took leadership role in forming the New Zealand Association of Social Workers (NZASW) after 14 years, in 1964. In 1972, NZASW urged the government to introduce new social service delivery arrangements, i.e. amalgamation of the Child Welfare Division and the Income Support Service, and to establish the Department of Social Welfare, DSW, under the ministry. The DSW was meant for the development and administration of effective social welfare policies and social welfare services. In 1973, the DSW established the New Zealand Social Work Training Council, NZSWTC, to get advice on matters of social work education and training. www.anzsw.org.nz. Russia. Social work was introduced in Russia in 1991 as a profession and educational program. It appeared along with significant political reforms during long-standing economic crisis and increasing social differentiation. This profession emerged along with other professions in the post-communist Russia when it changed from a communist country to a democratic capitalist country. In that decade, 1990s, the Ministry of Labor and Social Development, the Ministry of Education and Health Care, etc. introduced a variety of social services. Yarskaya et al., 2004. 4 types of social work programs are available in Russia, such as 5-year specialty program as per Russian traditional educational system, 4-year bachelor program at some universities, 2-year master program at 3 universities, and 1-year international master program at private school, e.g. Moscow School of Social and Economic Sciences. There is no PhD program in social work. Education and professional training of social workers have now been established in more than 120 higher education institutes all over Russia. It is very important to note that social work professionals are paid very low in Russia. For instance, a specialist in social work gets salary about US $540 per year, as per June 2003, which is equivalent to a nurse's salary or 2/3 of a schoolteacher's salary. A social worker's salary is about US $360 per year. Yarskaya et al., 2004. Turkey. A private university, i.e. the Baskent University in Ankara, initiated a Department of Social Work under the Faculty of Health Sciences in 2002. It continued as a 5-year course. It is debated that there is no need for the social work profession to be specialized in Turkey. Generalist approach is the best suited model for the country. Social work education in both Hacettepe University and Baskent University is based on the generalist approach. The students who complete their social work education from these 2 universities are absorbed by the Prime Ministry, Ministry of Health, Ministry of Education, Ministry of Justice, the Social Service and Child Protection Agency, universities, Ministry of Labor and Social Security, crises units, NGOs and so on. Balut,